everybody, and welcome to DE Business Lab. I'm Dr. Pam Maragliano-Muniz, Chief Editor for Dental Economics, and with me, by popular demand, is Kandra Sellers, the CEO and founder of TIPS Medical Billing. Kandra, welcome.
Thank you so much, Pam. Dr. Pam, I should say.
Please, call me Pam. All right, so I finally got to meet you in person. So you guys, I shoot these videos and I meet all these amazing people, but I don't always get to meet them in person. And I had the privilege of meeting you, Kandra, at the Chicago Midwinter meeting. And that was just so wonderful to do that.
Absolutely. It was, Zoom is one thing, but actually being in front of somebody and having a little bit more time and presence, I guess, it was amazing to meet you in person.
Same here. Now, Chicago Midwinter was a cool conference because many who went, and if you didn't go, you certainly missed out, but don't worry, obviously more conferences are to come all over this country. But this conference, more than I think anyone in the past, in the recent past, this one felt more like old times. And so I think every conference has its own feeling or its own darling, if you will. And so what were some takeaways that you took from Midwinter?
Yeah. Well, for starters, you are right. I felt like we were back to much more of the attendance and the excitement and the teams and just a lot of hustle and bustle the whole time, which was really exciting. But one thing that I really noticed is a lot more people out buying and purchasing CTs. And it is, or thinking or considering and having those conversations with the reps. But I think it's really important for people to understand that CT is a valuable piece of equipment in a dental practice. It's a large investment. And what I see from a billing perspective is a lot of people choosing to give this service away, which it doesn't make a lot of sense for me. As we look at our reimbursements are down from dental, our overheads are going, through the roof, nothing is getting cheaper. And why are we allowing, why are we not asking patients to pay for such a valuable service, such a valuable diagnostic tool? That I know your MD would not give away, and actually your MD is not going to do it, but an imaging center is not going to give that away, So that's one thing I noticed. And I love that people are investing in this technology. And there are a lot of pieces of equipment in our offices, and I get asked all the time, well, how can I get reimbursed on that? And, as a hygienist, the first thing that I think of is an ultrasonic. Well, you're not going to get reimbursed on the ultrasonic. You're going to get reimbursed on the services that you provide with the ultrasonic. It's a tool. It's like you having a drill. So, what does that really look like? And why aren't we charging for this?
I think that we feel bad. I think that sometimes we think, well, this is for me, so I can do a better job for you, or this is for me, so then the billable procedure that we're going to do from the information that we glean, you'll get billed for that. And I think also that, especially before the purchase, we're always looking for the ROI. We're wondering, when is the CBCT or other technology out there going to pay for itself? And this is why we're here. And this is why we're kind of taking a deeper dive on this topic. That now, guys, I'm going to ask you for a second. I know this is crazy. Just take your dental hat off for a second and just sort of sit back and listen to what medical is doing and how we as a dental practitioner can take advantage of medical billing. We just have to understand what exactly that means and how to play that game. And Kandra, you already, you know it. So tell us, what does that look like from an ROI standpoint? And how are there procedures that we currently either are under billing or not billing at all that we could and should be reimbursed for?
Sure. So let's look at, why would we take a CT in the first place? Typically, we would see something abnormal on a PA or an FMX or whatever, some type of 2D image. that would lead us to a path of needing something with 3D. A great example, and I use this all the time, is a cystic lesion. That cystic lesion on a 2D film, you can't tell how big it is, if it's expanding into the sinus, maybe, or is it invading the mandibular nerve? Is there impingement there? We can't really see that in a 2D image. So often I hear from staff or team members that, my doctor's always behind. Well, if they're not using this technology to help them diagnose and really understand what they're getting into in that surgery before they get into it, there's going to be surprises. So, the first diagnosis code that goes on my claims for CT is abnormal radiographic finding. We saw something on a screening 2D that led us down the path of a CT. Now, I often get, well, I want to take a CT on all my new patients because I see so much. I don't know anybody that wants to give their CT back after they have it because they realize how much they might have been missing, or what they couldn't see before. It doesn't mean that you can take one on every patient and that it is medically necessary and billable to medical. However, that being said, there's a lot of things that we see on a CT that does make it medically necessary. We see those cystic lesions in the jawbone. We see pneumatization of the sinus. We see bone atrophy, minimal, moderate, or severe atrophy of the mandible or the maxilla. We see, oh gosh, what else do we see in there? Impacted wisdom teeth or impactions of any sort. I mean, there's so many things that we can see on that image that allows us to diagnose further, or come up with those treatment plans for implants and grafting and all of these amazing things that we can bill to medical, because those are all things that are billable to medical. So not only is it, we can take the CT, we can also bill for the evaluation that goes along with that CT. So we get kind of stuck in this mindset of the limitations that dental has on us. We can only do so many exams per year. And then the rest, well, we just aren't going to ask the patient to pay for. We've really been brainwashed by the limitations of dental benefits, how often we charge, how much we charge, and when we charge. So, and I get that our patients are like family, but we do at the end of the day have a business to run. Mm-hmm. And we have, it's surprising to me that dentists are so, really don't, they get this beautiful CT unit in their office and then they decide not to charge for it. And I believe the main reason is because they find out that dental's not going to reimburse. And so then they just don't charge for it, like a lot of things that we don't charge for in dentistry. So that being said, when I look at the limitations of just x-rays in general, as a hygienist, I always had to choose between a pan or an FMX every 3 to 5 years. Now that didn't matter if it was good or bad for the patient. It was just what it was. But again, what are we missing by not taking, if my patients are almost always getting an FMX because they're older, they're adults, and we know what the perio rate is, we know that they have restorations, we really need that FMX, and we're not taking that pan, are we missing out on maxillofacial cancer? Are we missing out on those lesions that we then have to move to a CT to be able to identify that there's really something wrong with this patient? And I really believe that that's going to be a big issue, a big reason for lawsuit in dental practices, because we're missing that if we're not taking the images that we need and we're basing it on what dental's allowing us to do. But that being said, when we look at that ROI of a CT, it's really quite amazing when we think about what we can bill for this. So not only can we bill for the capture of the CT, which is about, if I look at just Medicare, the lowest rates that I see being reimbursed on it is $175. So we can bill for that. We can also bill if your machine extracts a pan, we can bill for the pan as well. So we get into these multiple things that we could potentially bill for out of that CT. So now we have a CT capture, we have the Panorex. Now I can tell you the Panorexes are not paid well by medical, but it's better than zero, which I often see on fee schedule, or not on fee schedules, but on reports. So say that's $22 from a Medicare standpoint. So again, the lowest of what I'm giving you like low numbers. And then we can also bill for a tomographic study, which is actually studying those slices of the CT. And Medicare fee schedule again is about $118. So you add that up to, and it's about $315 if we bill all of those individually. And the point of that is understanding that dental only allows you to do this and this every this many years. In medicine, we get out of that. These are all billable and payable services according to medical, as long as they're medically necessary. And we're taking them for diagnostic. We're trying to come up with a diagnostic treatment plan for a patient. Like, what does this look like for this patient? What's going on with this patient? So there's that. We definitely have more options and less restrictions when it comes to this. But I truly believe that most people just have not billed for it because the dental doesn't cover it, just like a lot of other things that dental doesn't cover. So there's that.
What does that lost revenue look like?
So the lost revenue, if I were, and I want to bring up something, because I can tell you, I have seen anywhere between $175 all the way up to $600 paid on a CT. Really, it's going to be based on the patient's their plan, the quality of their plan, not even so much the payer, because even within the payer, I see variations of what they pay based on what that plan has laid out for their employees. So there's a big variation there, 175 to 600. I'm just staying on the low end because I think while there's a lot of people like, ooh, $600, that's great, I'm going to charge $600. Are you willing to ask your patient to pay for that if it, a portion of it or all of it goes towards their deductible? Are you willing to ask the patient to pay you $600 for that? Because as soon as we submit that claim to medical, whatever becomes of patient responsibility, we need to attempt to collect that. So a lot of offices feel more comfortable saying, okay, it's 175. So, and again, I don't like to give astronomical numbers that feel like, the $1 million ROI gig. So, if we look at just billing 175 and not even the pan, not even the tomographic study, and we do one a day. And I know practices are doing much more than that. So again, I'm staying very conservative. That's $25 a month. We're looking at $4,375 a month. You take that times a year, and now we're up to $52,500. So if your CT machine, if it cost you $100,000, you could have already had half of it paid off.
That's a big deal.
I think it is. I mean, I'll take $52,000 any day. It's a chunk of change. Maybe in the scheme of things, it's not, but this is just one thing in our practices that we could be billing to medical and being reimbursed higher on. Now, if you were to break it down and get the CT, the tomographic study, the pan, and have that be $315. And again, if you wanted to charge just $315 for your CT, that's okay too. Then you're looking at, with the same amount, if you're doing 25 per month, now you're at $7,875 or $7,875 basically, which is getting close to $95,000 in production just on CT. That I know we're not consistently, capturing. And we're not even capturing it. And a lot of practices don't even walk it out, even with the zero, to allow the patient to see what we've given them as a gift, really.
So to be completely honest, I mean, this is such an opportunity that we need to take advantage of, that we should take advantage of as dental professionals and help our patients get payment for this. I mean, it's most of the time, it's not even payment that's coming out of their pocket, and we're getting the diagnostics that we need. But to be completely honest, we need coaching on this, because this isn't a CDT code, submit this somewhere else. This is a whole process, and this is a whole approach that we now need to bring this into our practice and train our team and make this part of our workflow. And I know this is what you do. Can you tell us a little bit about how you can help us and how we can reach you to talk about our specific practices and how you could benefit us?
Sure. What I typically do is have a practice send me their report of the procedures that they've done over the last year. And then we just start breaking it down. I mean, CT is just one of the many things that you could be billing to medical, and it's easy peasy to get paid for. And there's, people always ask about prior authorizations. There are ways to get around that as well. So because we are providing point of service care every day, all day, we're not sending people to imaging centers. We're able to diagnose and treat and get people out of pain today. So really my approach is very customized to what they want to focus on. My goal is to find opportunities of other procedures that they may be writing off, or that dental just doesn't reimburse for, and finding out what those are, and then having the conversation of, this is what you're missing out on by not billing these things. This is also what medical will allow for these procedures. Do you want to capture that? And if you do, then let's go get it. And so my approach is very, very much a one-on-one customized approach per office, because there are some people that are going to be comfortable with the 175 CT and others that are going to be comfortable at 350. And that's okay. It's not for me to say you should just, upcharge it. It has to be, where are you at in your region, in the region of the US, and what is your philosophy behind it? But at least, try to capture something, because we don't value what we do enough, and we don't value ourselves as medical specialists, and we really should. And we do deserve to be paid for the things that we're doing, instead of writing things off and wondering why we're not, being profitable, or why, it's just, it's amazing. We don't value our profession enough. Our patients don't value us enough either, in a lot of respects. We're used to giving our patients down to the penny what they're going to owe us. And medical doesn't work like that. So those are all the things that I help my practices with, is looking for the opportunities, and doing it in a way that feels comfortable for them.
Well,
because I'm dealing with different philosophies and different personalities. And, at the end of the day, they're the ones that need to have the conversations with the patients, and it needs to feel comfortable.
Sure. And we have to customize it for in our own practices and our own approach to care. Yeah. How can we reach you, and how can we get more information?
So if you go to my website, that's the easiest way. If you go to TIPS, which is TIPS, medicalbilling.com, go to the contact page, and you can reach right out to me that way. If you'd like to send me an email, you can do that as well. And it's Kandra, which is KANDRA at tipsmedicalbilling.com. Those are the two easiest ways. And I will reach right back out to you, and we'll set up what I call a medical billing analysis, where we can really discuss the opportunities I see. And, at the end of the day, it's up to you what opportunities you want to take advantage of.
Terrific. Well, thank you so much for all of this information. I think you've given us a lot to think about, without a doubt, and think about the possibilities and the lost opportunities in our practices. So, Kandra, I can't thank you enough for your time.
Absolutely. Thank you.
Thank you so much. All right, everybody, for DE Business Lab, I'm Pam Maragliano Muniz, and I look forward to seeing you next time. Bye.